Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jackie Frey. She's product expert healthcare at Zenzap. Welcome, Jackie.
Hi, John. Thank you. Thank you so much for having me. Very excited to be here. I've really been looking forward to this. So thank you.
Yeah, I can't wait to share what Zenzap's doing with healthcare. I know you work across a number of industries, but you have some kind of novel approaches that I think a lot of healthcare organizations would be interested in. But before we go there, tell us a little bit about yourself and Zenzap.
Thank you. Yes, Jackie Frey. I am a product expert at Zenzap, specializing in the US healthcare market. Zenzap is a HIPAA compliant work chat built for your frontline teams. And more than just that, we have built in AI agents that are creating AI workflows for your clinical teams. And really, truly, the whole idea behind Zenzap is really making something that is user friendly for your team to use, and that is conveniently located on your personal device that everyone always has on them. So, yeah, we just again, our focus is to keep your staff compliant while providing them with a secure app that allows for them to conveniently use it from their own phone.
Yeah. I mean, it's amazing how important communication is in healthcare and how often it doesn't happen, because they're afraid of it. But let's also dive into that. Like, why do we see a lot of people in healthcare maybe defaulting to their personal chat apps to communicate in an organization?
Yes, great question. So truly, I mean, we hear it all the time. I mean, every time I speak to somebody in healthcare, it's the same old thing. You know, they do have an app that they could certainly utilize, whether it's through their EMR, EHR, or just a legacy tool, really that their entity may already offer, but it's old, it's clunky, it's not user friendly. And every single time, the staff's going to revert back to what they know, what's easy for them, whether that's a WhatsApp chat, their personal device, texting, emailing. I mean, you name it. I mean, every single time, if it's not easy, user friendly, and convenient, they're not going to use it. And
Uh,
it really doesn't matter how good the implementation process is. It can be, a five-star implementation process, great training. If it's not easy and convenient, they're not
yeah.
going to.
The grossest example of this I ever heard was a doctor who we asked, "Why are you sending PHI over text?" And he said, "Well, they're not going to throw us all in jail." And I was like, "Well, that's probably true. You're probably not all going to be thrown in jail, but they could fine you. They could do other things." So, what are some of the other security risks and challenges when staff choose to use their personal apps?
Yes. So the second you send any sort of photo, I mean, anything PHI related, it is going to download onto that phone immediately or your personal device. It's really going to be completely outside of the organization's control. And there's no way to retrieve it or delete it from, an admin's
Mm,
perspective, right? So they're not going to have
mhm.
the ability to access that. And again, we hear about that all the time, wound photos, patient updates showing up in group chats that nobody in compliance even knew existed. The PHI sitting on a phone, the organization has no visibility, into it and no admin access, as I mentioned, which is a huge HIPAA, violation. And just to your point, they never think it's going to happen to them until it does. So it's just a matter of time. Yeah.
Yeah. Yeah, exactly. I think, and I think the enforcement's been coming up too, as far as HIPAA violations that are happening in exposure, and they're going after them in ways that previously maybe they didn't do as much. So I think that's interesting. How about the impact from maybe a clinical perspective of having multiple messaging systems where, the staff are using their personal devices, they're using the EHR, they're using some other legacy app. Like, talk about the impact from a clinical perspective.
Yeah, absolutely. I mean, it's kind of a no-brainer. I mean, if you have information scattered across, five different apps, care coordination is clearly going to break down. I mean, it just does. I mean, who's going to realistically use all these different apps to communicate? In fact, I have a good story. So one of our customers a local hospital shared a story that something recently happened to them, and Zenzap fortunately was there to help. So she had a patient that you know she had just performed surgery with a patient. She went home. She'd been on shift for 24 hours, and while at home, she received a notification that the intern on duty had prescribed a medication that would have caused serious reactions for that patient. And she caught it, again, and thanks to
Thank
Zenzat,
goodness.
she caught that. And, that really is a matter of life and death. I don't want to sound melodramatic when I say that, because, it really is a true story. I mean, that's fact. Had that patient received the wrong medication, who knows what could have happened. And this, hopefully doesn't happen, often, but let's be honest, it probably does. And so, yes, I'm a big proponent, as long as it's compliant. Obviously, I'm a big proponent of the physician and any provider having their mobile device. I think it's very important.
Yeah. So how should healthcare organizations kind of look to solve these issues and, be compliant and secure while still enabling the workflows that a doctor, a nurse, et cetera, needs to do so that they don't default to their own personal device?
Yes, yes. As I mentioned earlier, just give the staff something that they'll actually use, that also meets your compliance requirements, right? So make sure that there's a signed BAA in place. From the admin, make sure that there's instant access for removal when the staff leaves. That's a huge piece. Admin visibility across every team and location, granular permissions over who can create new chats or download photos. So yeah, I mean, obviously meeting those HIPAA requirements is first and foremost, very important, but also those other pieces, that the admin has full control over what the end users are capable of.
Yeah. So, I mean, you mentioned when staff leave. I think that's a huge security issue at so many organizations. How does Zenzap kind of approach that with a healthcare organization when it comes to staff turnover and ensuring that, that information is protected and secured?
Yes, and this is honestly one of the biggest gaps we hear about regularly. And in fact, for example, we have a multi-location dental practice that their practice coordinator, who was literally the face of the practice, had all the patient's information, had really the patient's preferences of providers that they wanted to use. I mean, really everything that you could have imagined, the practice coordinator had, and it was right there on a WhatsApp group chat. And so she ended up leaving and took all that information with her. Yes, of course, the dental practice deleted her from the WhatsApp group chat, but she still had access to all of the communication, which meant she had access to all of the the client's information. Well, she ended up going. She didn't just leave; she left and went to a competitor. So
Wow.
she took all that information with her, and the practice told us that that first year they lost somewhere close to $80,000 in revenue. So granted, this is just one example of the many that exist. But not only are you risking losing a lot of money, from competitors, but of course you're also risking um, all that patient information, the PHI. You're risking all the HIPAA compliancy that you've clearly just broke, for lack of a better word. And given how much turnover there is in healthcare, I mean, there is a lot of turnover in healthcare.
There
We all
is.
know that. This is a big deal for your compliance team and your HR especially.
Interesting. So what types of healthcare organizations do you see using Zenzap and what's driving the adoption? I mean, you mentioned dental. What are the big areas where you see people leveraging the Zenzap platform?
Right. No, thank you. Yeah, that's a really good question. I'd say really as far as entities and organizations, I'd say across the board. So whether it's, your small offices, your small, physician groups to your large physician groups, your teaching hospitals, your large systems. So really everything across the board in healthcare. But what we're really seeing is perhaps they may have a HRSA audit or an OCR audit coming up, a legal issue, something that, is audit related or compliance related is truly what's bringing them to Zenzap. That's
Mhm.
usually the trigger where they realize that the risk suddenly feels real and has a cost attached to it. So that's what we're really seeing that's bringing them to Zenzap. Um, but really, what I think drives them to adopt Zenzap, if you will, is the fact that it's just so easy. I mean, it's so easy to use. If you know how to text, you can use Zenzap. While, of course, the fact that it connects to or integrates with most of the softwares, if not all, that they may already be using. Um, and now with our HIPAA compliant AI agents and built in HIPAA compliant calls and video conferencing and transcribing, all the AI workflows that are being created within the app. Yeah, it's really more than just a chat app now, and it's the core of the organization. It's the central source of truth for these organizations. So yeah, I mean, I'd say that that's really what's driving them. It's just that it becomes the central source of truth, and it's as easy as texting.
Yeah. I also love that you have a low cost and transparent pricing, and that's probably really attractive even to home health, which I think is also has that, especially with their mobile people. Do you do a lot in the home health area as well?
We do. We do a lot in home health, senior living, yeah, nursing facilities. Absolutely, yes.
Yeah.
Very, very affordable. That's just one of our goals here at Zenzap is to make this very affordable and easy to use.
Yeah, love that. Where do you see kind of the future of healthcare communication going? And, it's amazing. We haven't mentioned AI. So how does AI kind of fit into that future of where you see healthcare communication going?
Yes, my favorite question by far. So, I really think the sky's the limit, to be honest. I think what we're seeing here at Zenzap with the AI agents, the AI workflows built in right into the chat, I think we're seeing something that we've never seen before, to be honest. I mean, it truly is revolutionizing the healthcare space, or is going to. I can't reveal everything, but we're about to reveal it all in a few weeks, or some of it. It's truly amazing. Agents, the AI agents living inside a chat can catch things, for example, catch things that busy staff might not catch.
Hmm.
Would otherwise have missed. It can summarize what's happened overnight. You know, for instance, that medication example I gave, so it can find medication changes that perhaps were incorrect. It can find buried chats built into a long message and pull what's most important out of that message. I mean, the attention can be the difference in how fast someone gets the right care. From a clinical, another example from a clinical standpoint is truly clinical decisions are staying within that care team. What AI agents do is make sure that the right person sees the right information in a timely manner. And again, truly is the difference of life and death. I mean, I think that, it, not only is it revolutionizing the healthcare space, for the organization itself, from a leadership perspective, it really is helping to improve and help your KPIs across the board for sure. So huge fan. The fact that the AI agents integrate with your EMR, EHRs just gives you know, the capabilities really, yeah, are just astounding, truly.
Yeah.
And again, we're going to see things that we've never seen in the healthcare space.
Yeah. And my favorite part of AI is we're just getting started. So I
Right,
think,
we
it's
are.
already exciting and there's so much more to come. This is
Right.
awesome. Well,
That's
Jackie, I
right.
appreciate you taking time to share these insights and perspectives with us and a little bit more about Zenzap and how you're helping healthcare organizations with their compliance, their security, the communication needs that they have. So thanks so much for sharing. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Jackie.
Thanks, John. Thank you so much for having me.